In the healthcare industry, it can be said that with numerous laws that directly affect the operations of the entire healthcare institutions, putting into mind policies formulated through political influence without leaving out regulations to undertake operations can be a vigorous task to manage effectively. This is why you need consultants and experts. Having to hire healthcare consultants can be seen unrequired, but if considered consultancy services offered will provide to be an asset. Project planning, preparing, training, undertaking research, monitoring, and implementing are just some aspects that come under the concept of consultancy. Our next session is titled Emerging Role of Consultancy in Healthcare. And for throwing some light on this rising trend, we have with us Dr. Amit Mookim, sir. Dr. Amit Mookim is a managing director of IQVIA, South Asia. He holds a master's degree in business administration from the Faculty of Management Studies, Delhi, and honors in economics from St. Xavier's, Kolkata. Sir is an experienced business leader with a blend of consulting and operating experience in a career spanning 19 years, with extensive work across healthcare, technology, analytics, and private equity advisory. Mr. Mookim has a successful track record of building healthcare business from the ground up, exceeding profitability goals, and driving increased revenue and market share. Sir is on the board of several national industry forums on healthcare, private equity, or venture investing. Mr. Amit also mentors startups and actively promotes the cause of entrepreneurship and innovation in healthcare. Once again, I request the delegates to type in the questions in the chat box. Dr. Rajiv, sir, would you like to say a few words?
Sure. Hi, Amit. Thanks for coming on board. Lovely seeing you again. You recollect our interaction briefly a couple of years back. And it's great to have you back talking to our delegates. And frankly speaking, it's always a learning experience. And whereas as consultancies, you do talk about business modeling and financial modeling and mentoring startups and all that. Probably as people who are into the hospital business, there's one thing which we would like the consultancy also to help us navigate a tight corner, and that is consultant ego management. I'm sure everyone, and I'm sure Dr. Natarajan, who's the CEO of our hospital, is would definitely like to learn from you whether this comes under the ambit and scope of consultancies as to consultant ego management or image management of the hospital, given the fragile egos of the consultants and more or rather fragiler egos of super specialists, how to handle that, because they are the backbone on which we work. So all yours, Amit, and thank you for coming. It's been great interacting with you over the last few years, and we look forward to having you on board at SYMHEALTH also, given your vast experience and expertise in this field. Thank you, Amit, again.
Thank you, sir. Mr. Amit, the stage is all yours.
Thank you, Dr. Kazi. Thank you, Dr. Rajiv. It is such a pleasure to be part of this forum. My special thanks to Dr. Abhay and Swapnil who reached out and invited me. It's always very tough to speak to such a vast group of students compared to doing a session with corporates or leaders or industry or government, because the sense of or the feeling of whatever I say will be important for them to take certain career decisions is the entire background with which I need to make sure that I relay a balanced message to this group. First of all, congratulations to everyone who's been part of this program. For whatever limited I understand, it's a fantastic program. And the fact that many of y'all have chosen to take a mid-career break and take this up, and the fact that y'all are looking at this as a particular profession in the future gives me a lot of comfort, because this profession is a very important profession because it shapes the mindset as well as transformation of any industry. And healthcare is one area, I don't need to say it today, but all of you all are seeing what is going on in the world today, and you can see what is going on in India. And I read a very interesting quote that in the war, when war happens, what wins or loses the war is not the strategy in the general's office, but the logistics on the ground, right? And you can very well see how building certain blocks in India is still much needed, which is where the role of industry advisors and experienced professionals like yourselves will come extremely handy and important. So I've set up a very simple session for us, and I'm hoping that we'll get some time to also do some Q&A. Before I start, let me just give a little bit of background about myself and why I was so excited to be part of this group. So folks, like many of y'all, I have come from a small town. So I was born and brought up in a small town called Asansol. And I did my studies there, moved to Calcutta, then did my post-graduation in Delhi. And then I landed up in one of the most reputed consulting firms in Mumbai, which was Arthur Andersen, about 22 years ago. And from then on, my consulting journey started, right? And why I'm saying this to you is that this is a very meritocracy driven profession. It does not depend on your background, whether you come from a certain family, whether you come from a certain place or a school. It all depends on how you are putting forward certain skill sets that are extremely critical that I will talk about, right? And from there on, from Arthur Andersen, where I did a lot of consulting for banks. So I did the whole risk management consulting for Bank of Baroda, I remember, which was my first project. And then I went and did a massive project for World Bank in Haryana, where the entire Haryana State Electricity Board was getting privatized. So I was part of that project. And then I did a bunch of work for companies like Domino's and Yes Bank and Pfizer, all because of the Andersen brand. From then on, I moved to Aon, and I did years of manpower consulting. So I did the entire VRS scheme design of one of the largest mutual funds in the country, and then went on to help set up their office in Bangalore and build the IT practice. So I worked with large technology companies which were growing. And then from there on, actually, I joined Infosys and moved to America and did technology consulting. So from HR consulting, I moved to technology consulting. And then I came back 15 years ago and joined KPMG to set up their venture capital practice, which because the India was booming as a venture destination, and then built their healthcare practice across India and broader Asia. So I traveled across 44 countries, actually setting up healthcare practice. And then I joined IQVIA, where I currently am. Why I'm sharing this to you is not to tell you about my massive experience, but I want to share this with you that consulting is actually a very interesting and exciting profession because it is based on knowledge and it is based on your ability to adapt and learn new things. So I did strategy consulting, then I did people consulting, then I did technology consulting, then I did financial consulting, and now I'm running a business. So it really is a very holistic kind of profession. I put together a few slides for us. So let me just jump through that, and I'll try and finish in the next 25-30 minutes so that we get some time to answer the questions. The first thing I want to tell you is that whichever is an industry or a business that is in rapid change needs an internal force and an external force, right, to be able to adapt to that change. And very simple example is if you look at a caterpillar turning into a butterfly, what really happens is that there is a huge push the caterpillar makes to actually come out and transform, and then the butterfly needs to learn to fly. So there is an external and an internal force. And in healthcare, if you look at it, this is one industry that has accelerated the pace of transformation over the last 5 years. I think we are late. We are very, very late. And it's almost like we are trying to change the wheels of a car while the car is moving on the road, which is really the problem we have in healthcare today. But having said that, I would call out three things which are transforming our industry, right? One is the entire universal healthcare program that is happening in India, which is the Ayushman Bharat. Now, why I think this is a massive program and it will lead to transformation is that for the next 20 years, I think this program will continue to make certain structural changes in our ecosystem. And what I mean by structural changes is that today, if you look at the mix between how a Indian citizen is accessing healthcare, today he is trying to go to a private facility. The public facilities still need an upgrade. The information is still very patchy. There is lack of transparency in the sector, and all of the industry needs to come together and build certain structural platforms on how skills can be built, how certain regulations can be put in place, how the technology needs to come through, how fraud needs to be managed, how healthcare needs to be financed. And all of this is really the steps that will continue to happen over the next 2-3 decades, because universal healthcare as an area is not a 1 year 2 year program, it is a 20-30 year program. So that's one piece that is happening in healthcare, which all of y'all are aware. And I will tell you what kind of opportunities it will lead to for consulting. Second thing that is happening is all of the innovation that is taking place and on technology. Now, there are 3 or 4 things you have to remember why it is so important for India. If you look at it, over the last 5 to 6 years, certain disruptions have taken place in the Indian market. 99% of Indian population now has a social security number. That was literally in single digits a few years ago. More than 500 million people have a bank account, which means that today, if somebody has to transact in a transparent way, there is an ability to transact, right? More than 500 million people have what is called a smartphone, right? Which is a really powerful device because it can do a lot of things in terms of healthcare, right? And then you have the establishment of infrastructure that can support digital health, like mobile wallets, companies like Paytm, Cred, Citrus Pay and all, which have come through. Like you have many companies that are building platforms for consumerism, right? All of the supply chain that is happening there. Now, that is one track. And in the last count, I have to tell you, there are close to 7,982 registered digital health companies in India, right? That number was in 3 digits few years ago. And only last year, more than 3,500 crores has been invested only in innovation in some of these startups, only in last 1 year. And the pandemic has accelerated it, right? So that's the second big thing in transformation. Because what I think is important here is that many companies will need to shift their mindset to think about how digital is not only now nice to have, but their strategy has to have digital and their strategy has to have innovation. And let me tell you, many large organizations actually do not have that mindset yet, where they will need external support and external advice and knowledge from the right people, right? It's very similar to HR, where many years ago you had industrial relations. That industrial relations became human resources. Then that human resources started breaking down into talent acquisition, well-being. It became compensation, benefits, and anything else, right? Now it is taking another form of purpose. It's taking another form of really great places to work. Same thing is going to happen on digital, right? Earlier it was just about ERP systems, but now digital have to be core to the strategy, and organizations have to understand how they work with different partners and networks. And here I'll introduce a concept of what is called frenemies, where a company you will work with will be a friend and an enemy, right? So you'll have a frenemy model. And then the last one is consumerism of health. And today, the amount of purchasing power and information, these are the two things that Indian consumers have much more than before, right? So they are taking their own decisions, they are making their own choices, and companies now have to think on how they address and understand what a consumer really wants or what a patient really wants, which is why this industry, I think, is in massive transformation, and you're in the right place to actually acquire this knowledge to support this transformation. Now, if I look at it, very simply put, what are the 3 or 4 opportunities that we have in this industry, whether it's public or private? One massive opportunity, and why I think it's relevant for y'all, because y'all are experienced professionals who have turned into students. There is a massive demand for talent across the board. Today, if you look at it at the leadership level, there is a major shortage of leaders who can drive healthcare businesses. Also, there's a major shortage of people who bring in a fresh perspective. So that a lot of talent is being brought on from different industries. Many people are bringing people from telecom companies, from FMCG companies, from chemical organizations, from banks who understand different aspects of the business and putting them in healthcare businesses because there's no homegrown talent, right? And second thing is new business models. Today, what a local pharmacy was may turn into a digital dispensary tomorrow, right? So there is a lot of innovation that is happening on business model itself. That is the opportunity for the industry. The third is investment M&A. Healthcare is the second largest driver of investments in the last 1 year. Lot of money is flowing in into healthcare, and that is also leading to M&A, which is where companies are trying to bring in growth through inorganic means by acquiring other capabilities or other businesses. If you would have seen in the last few years, especially in the hospital space, you would have seen the M&A of Fortis with Parkway. You would have seen Manipal hospitals acquiring other companies. You would have seen Max hospitals acquiring, and all of them are now consolidating, where they are trying to expand their footprint through bringing in and building their networks. And the last thing is about operational excellence. And I'll tell you why I think this is so important for the industry is that this industry has been one that has not put its focus on costs and on operational excellence because the drivers were very different. But now, as the industry is maturing, as technology is playing a role, if you look at what happened to when Uber came in, Uber completely disrupted the entire model of black and yellow cabs, right? There is a potential for companies to come in and disrupt other traditional companies just because of better operational excellence, right? And this is an opportunity to understand how lean thinking, how certain agile methodology can come in into this industry and really drive it. Often consulting is looked at as a profession which is of giving gyan, and gyan at the cost of the company itself, right? I was told many times by my clients, when I used to go and do work, that you guys are basically taking my own watch and telling me the time, right? And to some extent it is true, but to some extent it is also needed, because you will understand it given your experience in your organization. Sometimes it needs somebody from outside to show you the mirror, and which is where the value of consultants come, where they can look at a problem, elevating themselves up from a certain ground level where people on the ground may not be able to see the problem. And oftentimes, when I have been brought in along with my team and my colleagues to diagnose a certain problem, we have realized that the core problem stayed somewhere else. What we were told as the problem was just a symptom. And which is where I think this whole point about consulting profession is a very, very interesting and exciting profession, because your ability to understand the problem is incredibly important. And many times you may need the data from the company to even tell them what the problem is. There are many. This consulting is a massive industry. It's a multi-billion-dollar industry, and it exists in different shapes or forms. There are multinational companies like a BCG, McKinsey, Arthur D. Little, Accenture, IBM, you name it, right? There are Indian companies. There are individuals who practice their own consulting, right? But what is important here is the domain knowledge and the intellectual property is the value of consulting. And consulting is a very people driven business, right? The assets of consulting are people who carry the knowledge, but the organization tries to bring all of this knowledge together and package it in a way that can deliver value to the client. And if you look at it, there are almost 10 or 11 areas where consulting organizations operate. So one is strategy, right? Strategy consulting firms. So there are 4 or 5 big strategy consulting firms like a McKinsey or a BCG or a Booz. But what they do is they really look at the big trends that are happening in the industry and they take a longer horizon. So say, for example, 5 years later, maybe the largest companies in the world in healthcare, maybe Apple and Google, right? Now that's the lens you will have to look at and then work backwards to see what should be our strategy. And strategy for an organization is very, very similar to war. Business is run on the same principles as the war is run in the battlefield. The only thing is that the hierarchy in business has changed, not to such a level, but the mindset is very similar. So many strategy firms use a lot of theories of gamification and war and everything else, and deep knowledge of industry to forecast how that industry moves. So for example, when we do work as IQVIA for our clients, maybe say we work for a pharma company, we would really create a blueprint of how the company should think about the trends that are happening in the market. Like the 3 or 4 trends that I talked about, we would really bring those trends down and talk about what the opportunities for that company could be. And that would be a strategy engagement. Second is operations, right? And operations is very, very important in India because of the scale of business and the cost of logistics and cost of distribution and wastage and everything else. And as technology is coming in and more MNCs are coming to India, more modern manufacturing and distribution techniques are coming in, right? And hence, operations consulting is a massive area of focus. It's a bigger industry than strategy consulting. And you have companies like Accenture and A.T. Kearney and firms like Aisha Consulting and others who used to be there, who do operations consulting, which is consulting on the supply chain. So how can you choose the right supply chain model, right from manufacturing to chemist, right, for a pharma company? What should be the cost of distribution? How many distributors should you have, right? How should you create your plant blueprint? And that requires operational expertise. Third is technology. And technology is now playing a massive role because technology is creating and disrupting organizations, right? So again, you have technology companies like Cognizant, IBM, Oracle, and many of them work on big themes. So they work on a theme which could be mobility. So for example, say Symbiosis. Now, Symbiosis wants to create an entire platform for engaging in a mobile manner with the students. So that will be something that they may bring in as a solution, right? And that may have hardware, software, and everything else, but everything distills from a business problem. Second thing could be that, say, a Hinduja hospital comes and says, how do we improve our patient experience? What can we do with technology to improve our patient experience? So somebody would design the whole patient workflow and then look at the different areas in which technology would play a role, whether it's queue management, whether it's the EMR, whether it's a discharge management or whatever it is, right? So that becomes a project. The fourth area is M&A and finance, right? And I talked about it. It's a subject close to my heart. But when a company is buying or investing or raising funds to grow, they need external consultants to really help them craft the story, value the company, understand how they can grow, understand what could be the partners or targets they may acquire for that growth, right? So there is a consulting that is done there. It is done by people who have good ability to understand numbers, business models, ability to do a lot of spreadsheeting, right? And that kind of work and deal making. The fifth area of consulting is people and HR, where how do you do the organization structure design? How do you create roles within the organization and the sizing of the organization? How do you create a succession plan for leadership? Every organization needs certain capabilities and competencies. So what are the competencies? So for example, even in Symbiosis, there are certain core competencies of the instructors. There are certain core competencies of the other roles, right? So those need to be defined because that really brings in the intellectual wealth of the organization. So that has been done by companies like Mercer, Watson Wyatt, Hay Group, Aon, and some of these companies are giant global companies who do some of this work, right? Conferry and others. Then there is environment and safety, which is becoming bigger and bigger, where really one needs to understand for a company, say for example, a hospital. Now, a hospital is creating a lot of bio waste. How do you manage the entire bio waste? How do you create safety for patients? How do you create safety for your professionals? So there's an entire consulting around environment and safety. Then compliance and risk, right? Because that is a big issue with so much fraud taking place. So there are firms like Marsh and Oliver Wyman and others who do compliance and risk management. Then, of course, legal, quality. So there are many, many streams of consulting. And the message I wanted to leave here is that as you move along, you will have to understand that there is a certain preference and choice you will need to make to specialize in one of these areas, right? Because you can't be a generalist and a master of everything. Ultimately, you have to build domain knowledge in one of these areas to become a specialist. And that's a choice you'll have to make as you move along. Now, what makes a great consultant? To me, there are 5 or 6 things. And this was told to me, this sentence, that competence comes before credibility only in the dictionary. And I think this is a hallmark of a good consultant or a good advisor, that you have to establish credibility with your client. The client has to trust you to be able to be part of his or her growth. And that trust will come from 2 things. The trust will come from a genuine interest in supporting the client and not making it a financial transaction. And the second will come from the right technical knowledge. So which is why credibility of a consultant is very important. And I think y'all, with so many years of experience, will come across as people who have great experience of the industry, but y'all will have to translate that into what it means for your client. And y'all will really have to have the mindset that you are supporting the client and adding value with the right integrity. The second is partner in transformation. The consultant has to be seen as a partner, which means that the consultant has to walk the journey of transformation with the client. It shouldn't be that you give the gyan and walk away. The client wants you to be part of the transformation, and that mindset has to be there. And hence the advice that we give to the client has to be practical advice and advice that can be implemented. The third is intellectual integrity, and I consider this incredibly important, because when a client is hiring a consultant, the client is trusting the consultant for his or her knowledge. And we need to maintain that integrity of our knowledge. If we do not know something, we should not create a mindset that we have given false information to the client. Our trust will get lost. The fourth very important thing is a problem-solving mindset, right? The ability to understand what is the core problem and what is the symptom, right? And the ability to communicate it in the right way. When Dr. Rajiv was doing the introduction, he talked about ego management. Ego is not just about, consultants in hospitals. I think all of us as leaders think that we are capable and high achievement people, right? And if we are told that there is a problem, we obviously will get defensive. We have to be told to it in the right tactful way. And that is what makes a great consultant. Team player. A strong consulting solution will require many different minds. So you may come in from a clinical mindset. Somebody comes in from a technology mindset. Somebody comes in from a strategy mindset. All of them have to sit together and craft a solution, right? So the ability to work with different kinds of people and listen to them, add value to them, and be a good team player is incredibly important, because this is not a single game, right? It's very different from being a coach. A coach may be an individual, but a consultant is actually a team player. And you have to have a balanced approach between theory and practice, right? So you have to be very strong at certain theoretical fundamentals, but you have to understand how this is implemented in practice as well. These to me are the 5 or 6 elements that will make a great consultant, right? The good news is that if you look at this profession, people join from entry level of college, people join from within industry. It's a very fluid profession, right? And that fluidity of mind is what you'll have to maintain, because you will realize that it's a very, very exciting profession. You will meet leaders. Every problem will be a different problem, and every solution will be a challenge to implement, which is why I find this profession very exciting. Now, the interesting part about consulting is that there are very, very different kinds of career paths. You can come in from industry, you can go back into industry. You could have been an entrepreneur, moved into consulting, you can become an entrepreneur after you do consulting because of the rich experience that you will have after seeing so many different businesses and the network that you will create. Then you could have been an investor. You can become an investor because you will understand what businesses will succeed and what businesses will fail. Or you could become a coach or mentor. One of the traditional paths for many consultants, successful ones, has been that they have then joined as an advisor or a board member of certain companies because they bring in that richness of knowledge and the network. Now, I told you about my own journey, and if you look at it, I've had the fortune to work on very different types of consulting, right? So I've done business consulting, HR consulting, I did technology consulting, I did finance strategy and M&A consulting, and now I'm running an operation which is across India in the healthcare data and research space. And to me, I think one of the things that has helped me transition is to always have a learning mindset and always approach each thing from a very, very simple perspective, right? That there is a problem and that problem can be solved. But one has to be open to learning new and new things. And this has been my own joy that, every time 3 or 4 years I have moved into a different domain, I've actually picked up something new. My ultimate objective was that I wanted to run a business, which is why I wanted experience on technology and HR and strategy and finance and M&A. So I worked through that in the last 21, 22 years of my career to move to a business and operations role. And at some point, I do want to grow into that role. But what I'm leaving with y'all is that any path you take, I think your success will depend on how you really keep a very open mind, and you will meet younger people who are brighter than you are. You have to keep your ego aside. If you always think that just because you are older in age that you are superior in some way, I think you will not succeed in this profession. This is an apprenticeship model. A consulting firm is an apprenticeship model. It's a very flat structure. There are only 3 levels in consulting firms. You have a partner who's responsible for managing business and bringing in relationships. You have an engagement manager who's managing projects, and you have an associate who's doing problem solving. Many of y'all may enter at an associate level because y'all will learn the business of consulting. But then whether you grow into an engagement lead or a partner depends on how you traverse that journey. So I will pause here, folks. I hope this was a useful session, and I wish everyone the very best in this journey, and would be happy to take any questions.
Right, sir. Thank you so much once again for opening up the doors and passing on knowledge on a topic that needs to be amplified these days. I'm sure there'll be quite a few phone calls to you once we're done with the next 2 days session, and I'm sure everybody will want to know, me included. We have a few questions for you, sir. Let's begin with the first one. It says, what skill sets are required as a public health professional to enter the consultancy services?
It's a great question. And I think from a public health perspective, what I think the public health professional would bring in is the domain knowledge of a certain disease area or a public health program. But you will need to add certain analytical capability, communication skills, and presentation skills, which are general skills for any consultant, right? The knowledge has to be translated in a very crisp and clear way for an effective consultant. So these are the 3 skills I would say on top of the public health skill that are required.
Right, sir. Thank you so much. Another question that we have is, please, can you explain the work of consultancies with some examples for better understanding?
Okay, sure. Let me do that. So let me give you an example of one of the cases I worked on, right? Which was a transformation project of a large fertilizer company in India. Now that fertilizer company was going through a transformation because of leadership change. So the father was transitioning the next generation of leadership, right? And there was a major resistance to the new leaders who were coming in. So we actually did a full assessment of the leadership pool, and we worked with the organization for the leaders to adapt to them. So we did a culture assessment. We assessed the culture of the organization. We assessed the culture of the leaders. And then we did a match between the organization culture and the leadership culture and saw the gaps, right? And then we designed a program where the cultures could be as, aligned. So which means that we did analysis, we ran surveys, we did training sessions for the leaders and all of that. Let me give you another example on completely another side. I was doing a cost reduction assignment for a large hospital chain where they wanted to reduce the average length of stay. So they said, look, patients are coming in. We think that the length of stay could be reduced. Every day that would free up will result in crores of, additional revenue. So what do we do? So we looked at all of that patient case history. We looked at what was the average length of stay for certain cases. What were the outliers? Were the outliers coming from certain centers or certain doctors? Then we went to those doctors, understood why the length of stay for those centers was higher than others. If there were certain reasons why they were higher, then we ran a process reengineering exercise and we actually reduced that length of stay over the 1 year period, right? So this was a business process reengineering kind of project. Yeah, I hope that clarifies. Dr. Kazi, you're on mute. Dr. Kazi, I couldn't hear you. You were on mute.
Sorry, there's a technical error there. The question that we have for you is, just give me a minute. Yeah. If a person doesn't have science background, but the person does have 8 years of good experience of working in the healthcare field as a service provider, then can he or she still join a consultancy firm?
So I don't have a science background. I'm a graduate in economics and master's in general management. Nothing stops you. Again, going back, it's a profession that needs solid communication skills, solid problem solving skills, and an intellectual hunger. You don't need a science background.
Right. Thank you so much, sir, for that. And I believe Dr. Abhay Saraf, sir, has a few questions that he'd like to ask you. Sir, I'll hand over to you.
So thank you, Amit, for telling us, sharing with us your experiences and the needs for required skill set as far the consultants are concerned. This is a very useful session, especially for our participants who want to grow as far as their career ladder is concerned. They are spending a lot of time, investing a lot of time in learning all this and working too, right? So if you could elaborate on some public health use case, which your company is doing, probably they would be more able to relate what consultants do. Generally, it is a feeling amongst all of them, what I hear is consultants means they work for power sector, they work for railways, they work for Niti Aayog, maybe hospitals, but what do they do in public health? Let us say somebody is MPH or in hospital health administration. What are the use cases which he can think? Please, if you could share with us, it will be very useful. Thank you.
Thank you for the question, Dr. Saraf. It's a great question. And I think for public health professionals, the demand or the need for consultants is highest right now because we have started the whole program. There are 3 or 4 areas where public health expertise is used in consulting. One area, if you can relate to, is all of the work that donors do, right? So you have large donors like Bill Melinda Gates, Clinton Foundation, World Bank, IFC, who are putting in money for certain program areas like TB prevention or TB control, HIV control. Now, when that money goes in, they would like to understand how that money needs to be spent, what impact it needs to be generated, how do you monitor the impact. All of these 3 things need research knowledge. So somebody needs to be able to understand and strategize how to spend the money. Many times the donors do it themselves, but they also look for help from public health consultants to do market analysis to really understand the problem on the ground, right? Second thing is what is the impact, right? that impact, the quantification of impact is done through market research, right? To really understand what is the spend that a patient is doing, what is the economic direct impact on indirect impact, right? The third is the monitoring on the ground, where even we do a lot of work where we would send people to the field to survey the implementation of those programs and really assess the impact. Because ultimately, if that program is not implemented, it doesn't matter. So that's one area of work. Second area of work is what is called economic consulting for public health, where there are public-private partnerships. Like in roads, you see all the toll roads are public-private partnerships. Similarly, in healthcare, there are now public-private partnerships happening. And they are funded by IFC, World Bank, and others, where private players come and partner with public health organizations and build hospitals or run hospitals. There is an entire deal making or transaction advisory that is needed, where one will need to understand what price to put, how to bid for that, and that is where public health knowledge is needed. Number two. Number three is if you look at the entire National Health Authority and the National Digital Health Program, right, which is being trying to put in place, which is a massive health financing, fraud assessment, patient enrollment scheme. Their public health knowledge is needed because implementation is key. So knowledge of how the scheme will work on the ground, understanding the process flow of how a hospital works in patient enrollment, understanding the bottlenecks, and creating process flows will come from the knowledge that some of you all may have. So there is scope in research, there is scope in financial consulting, there is scope in creating strategy frameworks and documents for certain programs for donors, there is scope in operations process flows. And this is all in the last 7-8 years, we have seen this grow massively. Earlier, many of the people were being hired in power sector, finance sector. You're absolutely right, Dr. Saraf. But now there's a lot of demand for public health.